operating business. So tomorrow we'll have an update for you on what our timeline looks like here in our shelter-in-place order. And for now, that's all I have this morning.
Thank you, Mayor. Now I want to go to Casey Stoughton, Public Health Director, City of Amarillo.
As of 10 o'clock this morning, there were a total of 144 cases of COVID-19 reported in Potter and Randall counties. Since this is a fluid situation, the numbers reflected on the 2:30 report card may increase, but we want to report our most up-to-date information. Over the weekend, there were additional 5 recoveries, bringing our total to 9 recoveries, which is certainly something to celebrate. The Public Health Department is in the process of compiling demographic information such as race for statistical purposes. We anticipate this information being ready later this week. We currently have no residents in nursing homes who have tested positive for COVID-19. We do continue to work closely with nursing homes, environmental health, and HHSC to support nursing homes. Currently, the only way to slow the spread of COVID-19 is to stay home, continue to maintain social distancing with 6 feet between you and others, to wear your mask, and to wash your hands. Our drive-through testing remains open today until 3 p.m. Our phone lines are back, so we thank our IT department for getting our phones back in working order. So you can call 378-6300, and our call takers will screen and direct you for testing.
Thank you, Casey. Now I want to go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center.
Yes, good morning. As we enter a new week and finish our 2 weeks of Amarillo All In, I want to remind everyone at the risk of being somewhat redundant to continue to practice social distancing. The other important thing that I really want to mention is the issue that I brought up Friday of the use of convalescent antibody. This Wednesday will be 4 weeks, from my remembrance, of our documented first cases. That was March the 18th. Now, convalescent antibody are antibodies that are produced by a recovering individual that have protective value and may be beneficial and likely is beneficial to individuals who are critically ill with COVID. In fact, over the weekend, we had a request for that by one of our critical care physicians, and we were able just to obtain only 1 unit from Oklahoma City for that individual, as there were no others. So I would like to ask any individual that is at least 3 weeks out from their confirmed positive test, and they are symptom-free, to contact us at the health department if you would be willing to be a donor. Now, in order to be a donor, we would also need to confirm that you are negative with a repeat nasal swab. So we will continue to move forward with this and offer more details as time goes on. And that's all I have to say this morning. Thank you.
Thank you, Dr. Milton. Now I'll go to City Manager of Amarillo, Jared Miller.
Thank you. Public safety calls for service remain down. Amarillo Police Department yesterday was down 32% over last year at the same time. Fire Department is down 25%. AMR, or the EMS services, were down 34%. Obviously, these numbers are somewhat reflective of Easter, but also reflective of success that the community is having by staying at home, getting out less. These numbers are a direct reflection of that. I want to also echo some of the things the mayor said. Governor Abbott on Saturday extended the state's disaster declaration for 1 month. This does not extend to the shelter-in-place order that the governor has issued, which expires April 30th. Essential businesses, per the governor's order, do stay open. They have to follow the guidelines of the president and the CDC by practicing good hygiene, environmental cleanliness, sanitation, implementing social distancing, and working from home if possible. Non-essential businesses, a few received direct guidance, as the mayor listed, to close or to restrict operations to external operations only, like restaurants. Did not really speak to other non-essential businesses other than to say that they needed to follow CDC and president's guidelines and minimize social gathering and minimize interaction with non-family members. For the city, we have a little bit of additional guidance for non-essential businesses. We do want them to see and abide by four criteria that define low-risk business. Those are keeping all employees and customers at least 6 feet apart at all times, never exceeding gatherings of more than 10 people, take extra measures to sanitize common surfaces like countertops, point-of-sale devices, things like that, carts, and then also ensure employees and customers maintain enhanced hygiene practices. So each business is going to make the decision on whether or not they can abide by those criteria, and if they can make sure they're abiding by those criteria, we do want them to continue, or we do have criteria that allow them to continue to operate if they so choose, and if they're going to make sure that they're maintaining those criteria. I want to also remind everyone that we do have a drive-through testing center is still open. If you feel sick and have symptoms you think may be COVID-19 related, call the public health hotline at 378-6300. Again, that's 378-6300. They'll screen you over the phone, and if you meet the criteria, they will tell you to go to the drive-through testing center. Your name will be in real time uploaded to the testing center, so they'll be expecting you when you get there. That is at the Tri-State Fairgrounds. So call the public health if you feel you have symptoms related to COVID-19. They will screen you over the phone and then move you on. That number is 378-6300. Finally, as a reminder, about 2 weeks ago, we announced a new emergency notification system to provide current factual information on a variety of events, including COVID-19. We encourage citizens to continue to sign up for the service at amarilloalerts.com so you can stay informed. As of this morning, we have 3,676 people signed up. Encourage you to keep on signing up for that. It's going to be a great tool for letting you know important things regarding COVID-19 or other things. That's all I have.
Thank you, Jared. And I want to go to some questions from the City of Amarillo Communications Department. These are just questions we've heard through various means, social media, emails, phone calls, things like that. I'm going to try to direct them to an individual panel member, but if another panel member wants to participate and add something to this question, feel free to do so. This first question is more or less directed towards Mayor Nelson. Tomorrow, the council is scheduled to consider confirming or continuing the city's declaration of disaster order through April 28th. What are some criteria or information that will go into that decision?
We'll be, of course, listening to the data that we have from Dr. Milton and Casey about our current caseload. We're watching the graph of what's our line of cases doing? Is it still climbing? Is it dropping at all? And not just dropping, has there been significant droppage in the number of positive tests that we've had, which I don't think that's the case at all. We'll be looking at hospital capacity and testing capacity, because it's important that we continue testing people throughout the community and making sure, both for what Dr. Milton is suggesting, the convalescent antibodies treatment, but just for knowing our hospital capacity over the next 6 months is definitely tied to the volume of citizens in our city that have tested positive right now. So just trying to track all of that information and pull that data together will be part of what the city council considers. We're obviously considering also economic impact and the challenges that it does put on our business owners in the city. So prioritizing the health of our city also with the economic health of our city will be part of the conversation tomorrow.
I'm only speaking from my own personal perspective here, but I've noticed over the past couple of weeks a noticeable decrease in, for example, vehicle traffic in the city. How do you think the residents have responded to the shelter-in-place directive so far here in Amarillo?
I think Amarillo has gone all in. I've watched business owners shut their doors, completely close down to the detriment of their financial bottom line, but doing it for the safety of their employees, for the safety of their own families, and for the safety of their customers. I've watched families shelter in and distance themselves even from grandparents. I do think Amarillo has bought in and gone all in making this a citywide effort to fight the outbreak. And the best way to fight the outbreak was for us to be in our homes as much as possible. So, you know, how long we have to do this is a question that we're processing every day and considering. But I am so grateful for the sacrifices that we've made. We all have a role to play in this. Every single citizen in Amarillo has a role to play in fighting this outbreak, and going all in has made a difference in our numbers. And truly, I believe we've saved lives because of this decision, but most of all, because of the way that Amarillo has embraced it, and people have chosen to sacrifice and believe that what they're doing has saved lives.
Thank you, Mayor. I want to direct this next question to Jared Miller. I know you explained this before, but kind of do it again. How does a business categorize itself as a low-risk business? What are the criteria that a business has to look at to make that determination?
That's going to be determined by the business. I mean, well, the criteria are not determined by the business. Whether or not they can comply with the criteria and meet those criteria, that is determined by the business. But those criteria are keeping all customers and employees at least 6 feet apart at all times, never gathering with groups of more than 10 people, take extra measures to sanitize common surfaces like point of sale devices, shopping carts, countertops, things like that, doors to refrigerators or other areas where products are stored, and then ensuring employees and customers maintain enhanced sanitation measures.
Thank you, Jared. My next question is for Dr. Milton. And you've mentioned this before, again, should Amarillo residents be wearing a mask in public right now? And what are some of the reasons for this recommendation?
Yes, I made a formal recommendation about 10 days ago that we should wear a mask, a cloth or non-medical mask while in the community, if you have to be in the community. And the reason for that is that twofold. It's that this is spread via the respiratory route. So it's by people coughing, breathing, sneezing, etc. And also that there's a gathering and increasing evidence that there are a significant number of people who may be infected and not know it, or be just mildly ill, but still capable of transmitting that to someone in the public. So as we've all said before, I think being a good citizen and protecting your fellow neighbor, if you have to be out in the community, should involve wearing a mask, just in case you may be infected and not know it.
Thank you, Dr. Milton. My next question will be for Casey. You mentioned this a little while ago, the drive-through testing facility. If someone wants to use that resource, how would they go about doing that?
We ask them to call 378-6300, and our call takers will screen them over the phone. All of that information is gathered via the phone, and so that limits the time that they may have to spend at the drive-through testing, and then also limits interaction with the staff there so that everyone is protected. Then our call takers will direct them to the testing site, and they will then drive out to the testing site, stay in their car, and be tested. It's a nasal swab, and so they'll be tested there at the testing site, but they'll stay in their car.
Thank you, Casey. We now want to open it up to questions directly from our media. Media, if you have a question for one individual panelist, that's fine. If it's a general question, that's fine as well. Just go ahead and identify yourself, what media entity you're with, and you may ask your question.
And we'll continue with the coronavirus coverage on air and online. Just make sure you head over to My High Plains for more updates. Now we'll go back to regularly scheduled programming.